All right, as we head into our conversation, a couple of things because some very important information came out yesterday that was sent from Dr. Gosman, which I'm sure most of you have seen at this point. What we're looking at is kind of the wrap up for the end of the year, and so we have some pretty important dates coming up. This is actually going to be our final video lecture as it turns out. And this works out well timing wise because we are finishing up the last part of the reproductive system. We're going to go over the female reproductive system. Um, and then next week there will be a review, and then your final exam is going to be posted, and we'll get that taken care of. Grades can start going in on May 18th, and there's kind of a small window of time, about 4 days after that, and then grades will be finalized. So we are coming down to the end of things. Like I said, I'm sure you guys got that email, looked it over. What that means is for those of you that need to get assignments in, please make sure that you get assignments in, and make sure that as we move forward that you continue to get things submitted, especially with that test. So the test, you guys need to make sure that you are getting to that you are taking it and you're getting submitted on time so that those grades can be properly entered. With the test, it is not going to be their HAPS exam, and that was a point that was not clarified until very recently, how they wanted to go about that. Some of the instructors out at WIT wanted to keep their final assessment and have us go with that, and others, because of how we would have to deliver it to you guys, did not want it to be given to you in that manner. So a lot of back and forth and getting that all straightened out, and finally came to the conclusion that it is not going to be their HAPS exam, but we are going to give a final test, and that is going to be over the information that we have covered this semester. So we have done cardio, we've done respiratory, digestive, we've done urinary, we've also done lymphatic, and the endocrine, wrapping up with the reproductive. Now, I realize that that sounds like a lot, but things that you want to kind of keep in mind, all the information that you're going to be tested on, we have covered. So you guys should have that in your notes and your handouts. If you don't have that material with you, um, for whatever reason, you are going to have access to your computers. This is not going to be on lockdown by any means, so you guys can look things up when you are taking the exam. So it is very much expected that it would be an open note type situation, which would help. There is not going to be a time limit on it other than the deadlines for me getting grades in. So when you guys, it's not like you're going to have an hour to take it, but you are going to have a final point to which I have to have it so that I can get grades entered on the other end of things. So very important that you guys are watching those dates, that you are checking into Canvas, and that you're getting that all taken care of. Some of you have been asking about grades and what you can do to get grades up. Some of the assignments are passed because answers have been posted, but for those that are still open and you can take care of, go ahead and get those taken care of and work through those so that you can earn those points back. But like I said, I did post answers on some things, and that makes them unavailable as to getting them made up, but everything else is still up for grabs. So take advantage of that and get that taken care of. We are doing what we can to make this the best possible situation. So just so you guys are aware of that. Now, with that all being said, we do have a final conversation that we need to go over, which is going to be the female reproductive system. And the packet that you guys are going to receive, not very many slides in it as we go through the female reproductive system. The first slide that you are going to have in your packet is going to be just a cross section of the female reproductive system. And I'm going to spend a little bit of time here, and that's part of the reason why there's really not a whole lot of slides, is that I just kind of left everything within this one, different from the male reproductive system in the fact that there was individual slides that pulled out each part. But I like the idea of being able to look at everything on this one picture and being able to just see how it all links together in that way. So looking at this cross section of the female reproductive system, I'm just going to start on the top left and we'll kind of work through things. So you have the uterine tube. Uterine tube is a structure, it's kind of like the vas deferens in the male body. You have multiple ways to refer to this. So you have uterine tube, which is acceptable. Oviducts is also a term that can be used. And then you have fallopian tube. So if you hear those three terms used, this is the part that we are talking about. This is actually going to be the structure that is going to transport the egg from the ovary to the uterus. The next structure that you have there, it shows the ovary, and there would be two ovaries in the female body, one on the left side, one on the right side. The one thing that I don't care for, and it's how everything is positioned, but in a lot of pictures, when you just look at it, it looks like it's connected, like the ovary and the uterine tube are linked together, and that's not actually the case. So these two structures, there is a separation between them. There is a potential for an egg to be released from the ovary and never make it into the uterine tube. It can kind of go off into some of the other space and not make it to its actual destination. Doesn't happen very often, but there is the potential for that because those two structures are not secured together. Next, after the ovary, you guys have the uterus, and obviously this uterus would be empty at this point. If fertilization would take place, the uterus is where baby would eventually implant. And when you have implantation of the baby, it can actually happen anywhere within the uterus. And so it could happen on the front side, back side, top, bottom. It does not, that's all dependent on the baby, and that the gender has no determination on that and nothing else, just where baby ended up. So the uterus, when, like I said, it's not used, you can see how it would lay in position. And eventually, if fertilization did take place and baby implanted, that uterus would start to expand to accommodate the growth of the baby. And during pregnancy, one of the things that they will actually check is what's called the fundus, and that is the point of the uterus that is the furthest point away from the opening. So where baby eventually would make its exit out of the uterus, that is the open part. The fundus is going to be the complete opposite side. And as baby grows and develops, that fundus is going to move upward into the abdominal cavity of mom. And that's how they can track if the baby is actually growing at the rate or the pace that it is supposed to be. It's just a quick, easy check. And that's something that they will commonly do in prenatal visits. Just underneath the uterus, you'll notice the bladder. And with the positioning of the uterus and the bladder, you can see how not early on in pregnancy, but once baby starts to get to 4, 5, 6, 7, 8 pounds, having a weight of that size sitting on top of your bladder is going to restrict it a little bit, and mom will get the sensation that she needs to go to the bathroom a little bit more often just because of how those structures are positioned in relation to each other. So that is a very common complaint of expecting mothers, especially later on in pregnancy, just because of the amount of pressure that is now resting on top of that bladder. Underneath that, we have the symphysis pubis. That is the front part of the coxa bone, and that is going to help support the structures that you have within the female reproductive system. It's the same thing in the male reproductive system. They have that same bone, and it helps support those internal structures that we have. The next structure, it talks about the clitoris. The clitoris is going to be another place within the body where you have a collection of nerves, and so very highly packed with nerves. And this is also going to be highly vascular and have a very good blood supply to it. So in the female body, a lot of times the clitoris will be considered to be the equivalent of the penis in the male body because they have a lot of similarities. Both of them are going to be packed with nerves, about 9 times what the normal places in the rest of the body would have. And then also because of the fact that that blood supply is going to be increased when it is stimulated, and it will increase in size with that. So some of the similarities between those two structures, even though they are found in two different genders. From there, we have the labia. And again, this is where you see a lot of different names used to refer to the same structure. Most people will refer to them just as the labia, and you have the major and the minus, indicating a larger one and a smaller one. Now, the way that you can tell the difference between the two labia is the smaller, the minus, is going to lack any hair, And the majus, which is the larger of the skin folds that you have in this particular region, is going to contain hair. So all of those skin folds that you would have, those are referred to as labia, and just their overall location, um, or the presence of hair, excuse me, would then determine exactly which one you are dealing with. The labia are important because they actually serve a couple of different functions. Number one, they are going to help hold moisture into this region of the body. And then they're also going to create somewhat of a barrier against bacteria and viruses being able to easily get into the body. So they do serve a purpose, and that's what they're going to do. For the vaginal orifice, this is the opening into the female body, one of the openings that we have in this region. And if you look at this particular picture, you can see that there are three openings. You have the urethra, you have the vaginal orifice, and then you have the anus. So three different places here where material could potentially get into the body as well as get out. So when we went through our lymphatic system, we talked about the fact that you have a bundle of lymph nodes that are going to be in the groin region, excuse me. And the reason for that is because you have these openings to the outside world, which are present in both the male and female body. So vaginal orifice, that would be the opening into the vagina itself. This is also where when baby crowns, when you can first see the head during labor, that would be that point right there. If you move over to the right-hand side, top right-hand side talks about the fimbriae. Fimbriae are these finger-like extensions that you have on the end of the uterine tube, and they basically kind of float and create this wave-like action. And what they're actually trying to do is when that egg cell is released from the ovary, they're trying to draw it into the uterine tube and make sure that it gets to where it's actually supposed to be. Like I said, that's not connected. And so it's just a structure or feature that is present so that that egg transfer happens the way that it's supposed to. With the rectouterine pouch and the fornix that you have there, the rectouterine pouch is just simply a space that is created because of the position of the uterus and the large intestine. Nothing happens there. There's not an actual structure. It is just simply a space that is created where the intestinal tract and the uterus come together. With the cervix, hear a lot about the cervix. The cervix is actually considered to be part of the uterus. So we have the entire uterus itself. The bottom third of the uterus is going to be classified as being the cervix. And so one of the things during pregnancy that they will check is what's happening with the cervix, if it is thinned out enough so that baby can easily pass from the uterus and start making their way down the birth canal. The next structure that you have after that is the rectum. And you can see where that large intestine that would allow you to eliminate solid waste from the body is positioned, and how close that is to the uterus and the path that baby would have to take during the process of labor. Now, because of how everything is positioned in relationship to each other, it can cause disruption to the intestinal tract during the process of labor and delivery. And so a lot of times right after baby is born, before mom leaves the hospital, doctors will make sure that everything is functioning the way that it is supposed to with the intestinal tract, and that solid waste is leaving the body as it should. So they'll come in and they'll listen and make sure that you have good bowel sounds and things like that before you leave the hospital, just because you can see the track baby would have to take, how it could disrupt those other structures that are nearby. The vagina, also referred to as the birth canal, that is the path that baby would take during the process of labor and making their way into the world. The next slide that you guys have talks about the ovaries, and I kind of already identified this. With the ovaries, you have two in the female body, and with the ovaries, you have all the eggs that you are going to have at birth. And actually, the eggs that you are going to have are going to be produced during embryological development. So you actually are going to, you are going to have several million when baby is forming, And then about the time that baby is born, you're going to see that number greatly drop. And then at the age of puberty, and that varies from one female to the next, that number is going to continue to drop. And part of that reason is that if you kind of think of something having a shelf life, those eggs are only going to be viable or in good condition for a certain amount of time. And so we see some of those eggs get lost through the process just because of the amount of time that they are in those ovaries. Now, when you actually start or go through puberty and a menstrual cycle begins to the time that it ends, and you're looking at anywhere from around 11 or 12 to 45, 50 years of age. During that span, you're going to have a total of about 400 to 500 eggs that are going to be released. Now, with the ovaries will alternate back and forth. So 1 month, the right ovary will release an egg, and then the next month, it is the left ovary. So some women will notice that with their cycle, they have different symptoms. And the reason for that is that depending on the ovary that is releasing the egg, you can have different symptoms. You might notice more cramping 1 month. You might notice some other symptoms. Hold on just a second. So as I was saying, with the ovaries taking turns, they are only going to have to work about 6 months out of the year. Now, the reason that we do this is so that if there is damage to one of the ovaries, that there still is the potential that you could get pregnant. Like I said, the human body will do a lot of amazing things to try and make sure that we have a generation past our own. The next slide that you guys have is a slide that focuses more on the ovary. And again, you can see the ovary, which is positioned on the left-hand side, kind of a grayish, purplish color. And then on the right-hand side, you have kind of the pink coming in. Those are the fimbriae. With this picture, it again looks like they are attached to each other. That is not the case, but they are very close in relationship to each other. Now, with this positioning, one of the things that you can tell, and they only focus on one egg here, and like we're talking about hundreds of thousands of eggs that are going to be present in the ovary, but they are kept dormant, somewhat like the sperm cell were in the male body. They are not all the way through meiosis while they are in the ovary. So they will go through the process of meiosis up to a certain point, and then they stay there. Because again, you don't want the egg fully developed if it's not going to be used for several months or several years. And some of the eggs will never be released from the ovary. So there's no sense having them go all the way through meiosis and be ready for fertilization if they are still sitting in the ovary. So they will be kept dormant up to a certain point in meiosis. And then if they are actually going to be the egg that is released that month, as they start to make their way out of the ovary, they will go ahead and finish the process of meiosis. So when you look at the different terms that are identified here, you have the primordial follicle, the primary follicle, the follicular cells, the primary oocyte. What that is indicating is that these are the different stages that the egg is going through as it finishes off the process of meiosis, as it fully develops and matures and becomes an egg cell that could actually become fertilized in the presence of sperm. So when you're looking at the primordial follicle, which is on the far left, and the primary follicle, those are the very early stages. So those would not be viable at that point. The follicular cells and the follicular fluid, if you kind of think of an egg, crack open an egg, you've got the clear white material and you've got the yolk. That had that egg been fertilized, the yolk is what would have been used as an energy supply. That's what those materials are for. They are helping keep the egg nourished as it is going through this particular journey. So As that is taking place, the egg is getting ready, migrating through the ovary, and it will eventually approach the wall of the ovary and rupture or break through. There are some women that say that they can actually feel that when the ovary breaks through, or the egg, excuse me, breaks through the wall of the ovary. But that actually will be a transition so that the egg pushes through that wall and then starts to make its way into that uterine tube, oviduct, fallopian tube, whatever you want to call it. Now, you'll notice that it shows a corpus luteum, and that is going to be the remnants, that protective material that was around that egg cell as it was developing. And that will maintain and stay in the ovary for a period of time. And it will continue to degrade and break down. It kind of becomes almost like a scar. And it will be there for a while after the egg leaves. It will eventually break down and completely disappear. So once the egg is then released into the ovary, or excuse me, the uterine tube, it will start to make its way down to the uterus. The next slide that you guys have, we've already talked through these, so you kind of have that same picture that we had at the start. It talks about the internal organs that you have within the female anatomy. And I'm actually going to just go ahead and go to the next slide, which focuses on the uterine tubes, but also is taking a look at the uterus. And so on the left-hand side, if you were to look at these structures from a frontal view, that is how it would look if you opened up the female body and just looked at them as they are. On the right-hand side, what they've actually done is they've taken a cross-section of the uterus, so you can see through the uterine wall and into the internal structures of the uterus as well. So just a little bit different view of what we have going on with the left versus the right side of this picture. Now, on the left-hand side shows you the position of the ovary, the fimbriae, and that uterine tube that you have. One of the important things to remember is that fertilization will actually take place in the uterine tube. It does not happen within the uterus. And so because of that fact, what actually happens is it's going to take the egg anywhere, it can be as much as 7 days, up to 10 days after it's been fertilized before it actually reaches the uterus and implants. Everything happens for a reason. The purpose for having that time between when the egg is actually fertilized and when it implants is that sometimes mom doesn't know she's pregnant. Either she wasn't trying to get pregnant or just doesn't know that she is pregnant yet. And if baby implanted as soon as it was fertilized, you would have a lot of time where mom could be doing things, putting things into her body that would not be good for a developing baby, and not even know she's pregnant yet. So by having that fertilization take place elsewhere, and then you have that travel time, so to speak, of where the egg is now going to make its way down into the uterus, find a location, burrow in, and implant, it reduces that window of when mom actually becomes pregnant to when she finds out for sure that she is. So that's a very important feature within how that process happens, just so that, like I said, mom knows, has a very small window of time where baby becomes dependent on her and when she would actually kind of have that first clue that she could potentially be pregnant. So once implantation takes place, as baby became fertilized, one of the things that it will do is it will start to secrete a hormone, and that hormone is going to make sure that the lining of the uterus remains intact and maintained. So within the uterus, during a normal cycle, there would be a blood lining that would line the inside walls of the uterus. And if those hormones start to be secreted from that fertilized egg, it tells the female body to hang on to that blood lining. And then when baby gets there, it creates a place where baby can then burrow in, implant, and start creating a placenta and umbilical cord and start drawing material and nutrients from mom. Once that happens, it is important to understand that there is no blood exchange between mom and baby. Materials will cross through the placenta, nutrients will cross through, other things that are in mom's body will potentially cross through that, but there is no blood that goes directly from mom's body into the baby's body. So you could have a mom who is HIV positive and baby be born without it. And it's because of that design feature that we have with the umbilical cord and the placenta and creating a barrier between the two. Now you can see how thick the walls of the uterus are in this particular view, and the muscles that you have within the uterus are going to run both vertically, they're going to run vertically, they are going to run horizontally, and they are also going to run diagonally, so that when labor contractions start, no matter where baby implanted, if they planted in the top of the uterus, in the back wall, in the front wall, no matter where baby chose to implant, when those contractions start, they are going to make sure that everything is working together to push baby down and out. And so as that process begins, those muscle contractions will intensify and become stronger until baby is actually delivered. That cervix section, what they're looking for, they'll talk about the cervix thinning. You can see how there's thick muscle within that cervix region. They want that to relax and thin out so that baby has a little bit easier passage as it makes its way into the birth canal to be delivered. Now,